Good evening, friends. Today we are back with another very interesting discussions on conceptual surgery. And today we will be talking about trauma management. Now we have had a lot of sessions on theoretical discussions of trauma cases, how to use ATLS protocols, how to manage different uh, uh, traumas of different body regions according to the injury types. Over next few sessions, what we will do is we'll do case-wise discussions of how to manage specific case scenarios. This will enhance your understanding about how to manage traumas. It will help you in learning the decision making in trauma. So trauma care is not just about doing some skill sets, evaluating patients. I think it's also about how to take decisions in that crisis time, uh, because traumas can be very uh, dramatic, can be very stressful, can be very animated in situation. And most well-read people also, they experience uh, that they will froze maybe in that fraction of second that when such as trauma comes. So if you are trained in these kind of scenarios, I think it will help you in taking decision making in those scenarios. So we'll take maybe two scenarios this time, and further on in future sessions also will be keep taking different types of traumas, and we'll go stepwise of how to manage it. So let's get on with it. So let's take the first case scenario. It's a case scenario of a blunt abdominal trauma in a road traffic accident, which is one of the commonest form of accidents or trauma scenarios which present to us. The most common two types, I think I would say, one will be the road traffic accidents, and then the other would be falls. So these two, I think, comprises of the most common mechanism of injury in most of the cities, I would say. So the patient profile is that it's a 26-year-old man who was riding on a bike without helmet, as is very common in our country. And then he's thrown onto road after a collision with a truck. So, and patient presented with severe abdominal pain and dizziness. And when the paramedic who brought the patient, they informed us that patient was found on the roadside. He was conscious, but pale. He was immobilized, giving a cervical collar and a spinal board. Was given oxygen was started on the ambulance itself, and en route he did have some normal saline which was given to him. And and it took around 25 minutes for the patient to arrive to to the hospital. So that's the condition we have. Now, whenever this information is given to us, or when the initial information we get from trauma, it can be anything. It can be how the patient got injured, how the patient was brought, what is the initial condition. Also, if there was a passenger or there is a side or a companion with the person, I think the status of that person also is very important. So these are some initial informations which tells us a lot about what could be the mechanism of injury, how severe was the accident, and what all we should expect. So I think this is the trigger which starts this thought process in our brain that what might be the injuries which I'm dealing with. So now here we know that it was a high velocity trauma which led to fall. It could be head injury, it could be chest injury, it could be abdominal injuries or pelvic injuries, depending because of the fall. So those things we need to see while this. And very important information is that the patient is without a helmet. So that also will make us curious about the status of brain injury in this patient. And then complaints is severe abdominal pain and dizziness. Now, in trauma scenario, dizziness typically will mean some kind of shock. It can be shock because of the trauma itself. even if the patient does not lose blood, but patient, just because of the acuteness of the scenario, they are afraid, they are panicking, because they've heard, all their life, they've heard so many bad things about accidents that the people lose their life, people lose their limbs after such accidents. So most of these patients, even if they are not injured severely, you may find them in a state of shock, which is mainly our body's response to preserve vital functions. Uh, Also, patient may have lost blood, which can lead to shock. Also, patient may have some injuries, which is affecting their oxygen carrying capacity through the body. So again, they will present with shock. So it can. So in this case, typically it depicts that there is something happening. Uh, that patient has abdominal pain. So obviously that points towards what major organ we need to see. And rest thing is routine. So, and also we saw that 25 minutes is passed, so still this within the golden hour, patient is there. So the first thing after this information is mentally or within your team, you should prepare as soon as you know that there is a trauma patient is coming to you. Uh, how do you plan? How do you prepare? Uh, now, now, for every case who comes, if we start making a plan which is separate, which is very unique and special, I think it will take a lot of time and we'll waste a lot of time in just planning and preparing for trauma case. That's why most of the trauma teams, they rely on one single protocol. And one such protocol is, I think the most popular one is the ATLS protocol. But again, let me tell you, ATLS is not the only protocol available. There are some countries, some colleges, some associations, they follow a certain slightly different form of protocols. But the sense of most of these protocols is same. Like we have PTC, we have ATLS, we have many such, that we should give priority to the kind of injuries which will kill people faster. So broadly, we know that airways will kill faster, than blood loss, then infections, then direct traumas. So that way we go on. Uh, so 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 I think what you should do, or what any trauma surgeon or any trauma team should do, they should agree on one protocol which they would follow without any confusion, and so that the whole team knows that what has to be done first and then what, so that we all speak the same language. You are free to decide which trauma protocol you want to follow, but there has to be one protocol which is written and accepted by all the people in your team. So that will help you in this step. So now let's come to back to this case. If what we will plan. So yes, now we are expecting a trauma patient which may have lost blood and which may have some internal injuries. So what background preparations I will do is I will try to arrange blood. I will try to assess whether the blood bank availability is there or not. I will see whether my operating room is available or not. All my team members should be there ready. I should have fluid colloids ready for initial resuscitation. I should have a chest tube uh, and all that apparatus available if there is a need of airway. So, and then when the patient arrives, I'll start with the algorithm. So let's say the patient has arrived, we start doing the assessment and we follow the ATLS protocol and of ABCDE. So when I assess A, so I found that the patient is with cervical collar maintained and using inline stabilization. Now here the question arises that how to assess airway. One very good, very fast way is to just ask the patient name and how he's feeling and maybe the symptoms. So if you're asking some questions which makes him speak, so if I'm speaking, I'm using my airway, which has to be patent. I'm using my respiratory capacity to blow out air so that I can phonate, I can create sound. And also I'm using my mental capacity to think, comprehend the question and then answer accordingly. Sometimes just asking a name may be a reflex answer, so you may not be able to assess. But if you ask that what happened and how are you and what are you feeling, I think this will give you a good interpretation of all the first initial few parameters like